An area where physios in general have a lack of knowledge. It's an area that we don't really understand very well.
Yeah.
I've been looking for a course for nearly 2 years now to cover the type of things that were in your course. When I seen your itinerary, I thought it's ideal.
Yeah. And what was the problems you were facing clinically which made you to do the course? What sort of issues, problems?
The proper way to assess for that, especially the fact that you do functional testing, so rather than just doing static orthopaedic special tests, you've integrated function with manual therapy, with exercise therapy. So basically you've covered the basis from a full assessment right through to end-stage rehab, and I think that's something that's been lacking in this body part for a long time.
And what is the best part of the course you feel after you've done so far, which you liked?
I don't really think it's a best part. I think what it does, it brings everything together, and especially the fact that you have a strong functional component within it. So the way, especially we've done it at the start, how do people move? Because that, your subjective of hugely important, but then how do people actually move? So you've integrated really important things about your layer concept into the functionality of the region.
And do you think it will change your practice?
Yeah, I think definitely there's a lot of techniques that you've produced in the in-service that that I wasn't aware of before. So some of the rehab techniques, even the little things like the discs, functional training, which I'm assuming you've integrated from your running course, etc.
Well, if somebody was thinking of coming to a course, what would you say to them?
If you want to improve your knowledge and understanding and your ability to rehab the hip, especially obviously if it's biased towards labral or FAI, I would absolutely encourage somebody to come on a course like you run.
Thank you. Thank you.
Because I treat hips, and I'm not sure I treat them that well, and there aren't many hip courses around, as it's recommended by a colleague of mine, and I found it really excellent.
Fantastic. So what aspects of the course did you find particularly useful? What do you think you'll use in clinical practice next week, if anything?
A lot of the tests, and there's an awful lot of exercises you're given and techniques, which some courses don't cover. They do so much of the sort of not the theory, and then the practical gets a little bit missed out. So I like the aspect, and I'm also very impressed with all of the on the course notes, and the fact you've got that video link that's got a whole load of info that I haven't seen yet, but it sounds great.
That'll keep you busy for a couple of months. What would you say to somebody who was undecided, who was thinking of going on a hip course, who was interested in FAIs and labral tears? What would you say? Would you recommend the course?
I'd highly recommend it because it's pitched at a very good level, and I'm sure if you knew a load more about hips, which some of the people on the course have, obviously do ask you some things, but for my level, which is I know a reasonable amount, I've been around a bit, but I've learned absolutely loads, and and I actually don't just treat hips, I treat lots of sort of chronic problems, but hips are certainly a big part of it.
Fantastic, thank you very much.
Week of physio, and I work in two areas. So I'm a physiotherapist for a contemporary dance company, Rombe Dance. So I'm the company physio, and I also work in a private hospital, Spire Bush Hospital in Bushy, so in the outpatient musculoskeletal department.
So what appealed to you about brought you here today?
Well, the patient population that I see, I deal with a lot of hip pain, particularly with the dancers. It's probably the most frequent prevalent injury that I deal with. So it's a young, active population that experience a lot of pain, and I thought this course was, the thing to do to bring myself up to date. Not just with techniques, but also with the latest research, the latest evidence.
Brilliant. And do you think that the course met your expectations in that respect?
Absolutely. Yeah, definitely. I thought just the practical tips that were given in terms of assessment, exercises, particularly at an advanced level, was exactly what I need to take away to apply to all my dancers.
Fantastic. So there's lots you can apply to even that population of elite dance.
Yeah, and also just having all the latest evidence, all the latest research, readily available to go and review and back up what we're doing. I think it's important.
So, what would you say to somebody who's thinking of coming on the course in the future? Would you recommend it?
Yeah, don't hesitate. Absolutely, come and do it. It's well worthwhile. Even just for the exchange of ideas, because we can all bounce ideas off each other. And
thank you very much.
Yeah, thanks.